So a quick little bit of a chat about patellofemoral joint syndrome. Obviously we see this a lot. Slang is runner's knee. Obviously we see it a fair bit. It incorporates obviously a little bit of muscle imbalance going on there. Obviously tight rec fem is always an integral part of it, but in terms of assessing it, what are the signs and symptoms? So simply being, for a true patellofemoral joint syndrome, we're obviously talking about pain that may be retropatellar, underneath the patella. It should be painful on a squat straight away. The unfortunate position of the patella creates a lot of that retropatellar pain because it obviously comes to the lateral, and that can be dragged out because some of this tissue here. I don't know if I'm convinced on whether or not the actual vastus medialis oblique is actually quite weak. I think that there's a lot more likely the fact that these structures here become quite dominant and that inhibits it. So obviously once we release this, obviously the body changes, the dynamics there, and there's no real weakness of that VMO. But what's important is the assessment of it. So pain on squat, no doubt about that. It probably will be quite painful on squish tests, so pushing back down onto the kneecap while the knee is in extension and then moving the patella backwards and forwards. Okay, classic example. And the one muscle that I'm concerned that gets missed quite a fair bit with it is our popliteus muscle that sits in here behind the back, and it wraps around to the lateral portion of our knee here into that meniscal area through there. Really quite unique, but because being a rotational muscle, obviously it can change a lot of the dynamics of the actual knee joint itself. So keep in mind patellofemoral joint syndrome, absolutely clear these rec fem, vastus, lateralis, but always keep in mind your popliteus muscle. So coming down through to the condyles of that tibia, okay, you'll see obviously there's a nice little fossa in behind that area there. If you sink in there up and down, you should pick up that popliteus through there, trigger point. So you can just sit on that and just hold that, move a little bit through the tissue up and down, try and pick up the really significant trigger point, just wait for it to release. Usually you'll find a big change to that knee joint issue.